Our next case is about Ukrainians' flexibility, flexible approach, and willingness to solve emergency problem in non-linear way. I want to invite on this stage our next speakers, Vlada Nedak, Chief Executive Officer of Women's Opportunity Fund, and Irina Slavinska, Chief of Administration of the Executive Committee of Kramatorsk City Council. Vlada, Irina, we look forward for your presentations.
Hello. Good afternoon. It's a pleasure maybe to finalize. I'm not sure that we are the last case today to represent a big project which was born from a small email. The project which was born from a request we've got from Sumy region that several nurses need e-bikes. I was really surprised to understand who are the nurses, what they are doing, and why they exactly need e-bikes. In a month, we found the company who delivered the first e-bikes to Sumy region, and I will start my presentation with the portrait of the medical worker who used our project. Olena is 62 years old, family doctor, in charge of medical care for almost 2,000 residents of Kramatorsk community. She makes up to 10 home visits for sick homebound patients daily. To get them, Olena has to travel 4 kilometers one way, often under missile attacks and endless air raids. Now Olena has special equipment from Women's Opportunity Fund to make her working conditions a little easier and reduce the same time she has to spend to get her patients, which often makes a huge difference. It's an e-bike, which she skillfully rides. New e-bikes is set in motion just by pressing a small button. Dr. Olena didn't leave Kramatorsk at the beginning of the full-scale war in Ukraine, and he stays here because of her community, elderly mother, her son, and the beloved family house. Every day, people who need medical care wait for Olena to visit her. Many doctors has left this unsafe region, leaving Olena with a lot more duties, but she no longer has to walk long distance. She uses a reliable, modern vehicles donated by our foundation. I love riding my bikes. For me, it's meditation after a hard day of the work. I'm very small. I'm just 1 meter 60 centimeters tall, and my colleagues didn't believe I could handle an e-bikes, but I did. We are committed to improving the lives of women we haven't even met. That's why we haven't been implementing Vela Forsage for a year already, ensuring that medical professionals and female paramedics in frontline and border communities have better mobility. Since we launched our project, the team purchased and donated more than 240 modern e-bikes to rural communities for a total amount of the project is $250,000. The project is supported by our donors. It's International Jewish Women's Organization Project Casher US. It's International Council of Nurses and the Jewish Federation of North America. Dorozhnik Retro Velotrade electric bikes made by Ukrainian manufacturers and produced in Kharkiv. These vehicles provide paramedics with an ability to get to remote locations, reduce the time needed to reach their patients, save money on fuel and car repairs, and often literally save lives. The bikes is equipped with an electric motor, Czech Republic, easy-to-use steering mechanisms, and a high-quality brake system. It's equipped with a real luggage care in front of basket, which can be used to transport medical equipment and first aid medicines. Together with our partners, Kharkiv-based bicycle manufacturer, we are implementing this project to facilitate the work of doctors so that they could help as many people as possible. Our electric bikes used in communities of 8 regions already in Ukraine. More than 350,000 medical declarations have been registered in these regions, and all these people hope for timely help and for improved health. It's often a challenging job, peacetime healthcare workers, as the distance to the border with Russia or front line is between 5 and 30 kilometers, and these regions are easy targets for hostile ballistic missiles and multiple artillery rocket systems. Our e-bikes cut the time doctors spend to get their patients by 3 times. That's especially important in situations where the speed is critical to saving lives. Previously, medical workers in these regions has to work or to ride old regular bicycles to visit their patients, which left them exhausted at the end of each day. We understand that up to 70% of paramedics are women, and our fund is focused on supporting and helping Ukrainian women who, despite the war, provide medical care, education, develop family businesses and entrepreneurship, and take up leadership positions. Today, I am here with Irina. She's Chief Administrative Officer of Kramatorsk City Community, and I'm delighted to have this partnership. Speaking of Kramatorsk, more than 100 medical declarations have been registered here. Medical statistics show that in the first 10 months of 2024, the number of doctor visits to patients in the homes reached 199,000. Every month, at least 19,000 people in Kramatorsk waiting for the doctor to come and to see them at their homes, and now they can get faster access to medical care. This spring, Women's Opportunity Fund donated 15 e-bikes to Kramatorsk Medical Air Center, which is the only one that provides emergency care as well as supportive therapy and palliative care to patients in the last stage of incurable diseases. I can say that it wasn't an easy decision because we understand where the Kramatorsk is located. But the number of declarations, the number of information about families and kids and women, we understood that it's just equipment. There is still a number of people who live their everyday life, and we need to support them. In 2025, in 2026, Women's Opportunity Fund plans to expand the project to another 5 regions of Ukraine and provide both medical and social workers with convenient transportation, because the number of requests from social workers is really huge. The mission of our Women's Opportunity Fund is to promote the development of Ukrainian society and foster inclusive, sustainable growth through women's empowerment. We see this project as an important step towards effective medical care in rural areas and improving the quality of paramedics' working conditions. We invite you to follow our activities, to see how we spread the project in the areas, and to join us in this project. Today we are at the conference in Warsaw. And the other day, I saw in media a remark made by a Polish volunteer, maybe you know, Kacper Szynicki, who says very interesting statement. The war is only a bike ride away from Poland. He cycled from Warsaw to Kiev to support and to raise funds to rehabilitation of Ukrainian defenders. It was 850 kilometers in 6 days, the same distance back on his way back. And we sincerely hope that our paramedics in Ukraine work-related bicycle trips will be successful and fast. People's lives and health depend on these rides. That's our Veloforsage project. And I'm pleased to jump into Ukrainian language and to speak with Irina about how this bikes serve to the communities and to get more details for you. Пані Ірино, буду сідати.
Dear Irina, I will sit next to you. So I have mentioned that it was not a simple solution to provide this community, since we realized that the community is located very close to the front line, to active hostilities. But when we communicated with medical staff, we received numbers of the number of population which receive services from healthcare staff. And unfortunately, the transport system was in critical state in terms of providing urgent medical assistance. So we made the right decision and quick decision to provide these e-bikes. Irina, tell about other challenges you faced during 2023 in your community. Our community, starting with the beginning of the full-scale war, is one of the largest communities in Donetsk region, including 14 villages. Its area is about 41,000 hectares. After the occupation, Kramatorsk became the center, municipal center in the region, and new projects were launched. We reconstructed our hospital, our schools received support, and first the construction of new housing began. So the community was developing, but after it was everything. What was happening was before the war, but during the first days of the war, the number of ambulances and the number of population decreased. Especially the population, those people who lived in multi-story buildings. They left their houses and they went to the villages located nearby. Yesterday, I saw the presentation of your community, and I know that you have had enough time to renovate many things. So maybe you can share some information about most innovative projects and what support was received so far. Since the beginning of the full-scale war, the key projects were aimed at reconstruction and quick renovation of administrative buildings, schools, kindergartens. And the main thing is support of hospitals and medical assistance. The community, which had more than 200,000 residents, now we have only 90,000 residents. And so first of all, the support provided to medical services and provision of high quality medical services. I would like to repeat once again that due to the assistance of our fund, you have received e-bikes. And now, so far, I know the story of one family doctor who still stays in the city. What about other medical staff? Did they come back, or maybe you received new medical personnel? Before the war, there were almost 160 doctors or medical staff and 260 nurses. During the first months of the war, their number reduced twice, and it was very critical. Now we have 163 nurses and about 100 doctors. But since the community is very large, its area is large and the distances are very big, it is very complicated issue how to get to some residents. So e-bikes helped a lot. The lack of fuel, the lack of ambulances, these were the challenges. So e-bikes are comfortable because, first of all, they have the basket in front, and the doctor, and mainly our doctors are women. It happens so. So women who have to take some equipment, medicine, even water. So it was impossible to bring everything. So it was very comfortable to do it using e-bikes, and it helped us to save many lives. due to on-time help, medical assistance. I will ask a general question. Is personnel satisfied? Because now they are quite mobile. This e-bike can be used for 12 hours without recharging. It's quite a lot. So there is a possibility to use this e-bike. What do women generally say about their experience? Is it easier for them now? It's just the right distance between which we require, distance between the hospital and residence. And when a doctor has to take many things, much stuff like water with her, now they receive lots of gratitude from patients who receive those services.
I know that there are some talks that perhaps due to this there is more time to devote to the family. One can go home earlier to do some educational online courses, to do things, because people then you don't have to waste time when moving from patient to patient, so work can be done somewhat quicker. And so people have more time to stay with the family and to learn new things, which is important. Well, it's not that you can come home early, but at least you can do more. Well, that's the case, that's for sure. And yes, we have been able to renew some educational activities, and that has improved communication. Thank you, Irina. I think that our dialogue will have to be concluded now. I don't know if there are any questions. We're very open to work with you and to run this dialogue with you. Thank you very much.
To our speakers. No? Okay, I have one question, as always. Влада, скажіть, які наступні регіони?
So, Vlada, what are the other regions that you would like to start working in, and what will be the criteria for the selection of regions? Well, Kramatorsk has helped us to understand that there's just equipment. And to feel sorry for technology, well, of course, everything costs money, but people are more important than equipment. We have to think about people. So now there is high demand in the Mykolaiv region, and those are the territories that have been occupied, but also from the Zaporizhia region. And I know that the map of the Zaporizhia Oblast is changing, but there are many people, and even today a community that was presented today, the Shirokivsky municipality, they have 17 hospitals, and they have a large number of nurses working there, and those are the municipalities that we have to work with. We had to stop work with Sumy, and Sumy was the first region where we worked, so we covered their needs. Now we're working with the neighboring regions, but also in Kharkiv region, and now we are working with medical healthcare professionals only, but there are also social workers who work with the people who with the lonely people or with elderly people, so they also need this type of help. So Kharkiv is the unbroken Kharkiv. This is where they produce these bicycles, and this is how we give jobs to people, and this is how we support the team there, and this is how we support our manufacturer. Thank you.
A small project makes a great shift.
Thank you so much. Thank you.